What's up, guys? Welcome to episode 60 of the unofficial NCLEX podcast. This is titled, Assess Patients' Ability to Balance, Transfer, and Use Assistive Devices Prior to Planning Care. This is pretty important. Now, I want to first identify or define assistive devices. When I say that, I mean things like crutches, walkers, canes. Those are what we mean when we say assistive devices. And nurses play a pretty legit role in that. Quick personal story, my husband ruptured his Achilles tendon playing basketball, and we had to go to the emergency department, and we had to get some crutches. So his nurse sized the crutches. It was her responsibility to size the crutches, teach him how to use them, and she had him walk around the unit with them before we were allowed to leave, which was completely appropriate. And the way that's supposed to go is, hey, I'm showing you how to use this device, and you got to show me that you can use it before you can leave. Very common in the emergency departments to provide that kind of education. However, if you're on the floor or in the ICU areas, you may be running into more of physical therapy is playing a part in this as well. The thing you don't want to do is just say, oh, physical therapy's got it, or you just give them what you think they need and assume they know how to handle it and deal with it. No, we as the nurse have to educate and have them do a return demonstration to show, I can safely use these crutches, walker, or cane. Because if they don't, they're a huge risk. They're already at risk for falls by utilizing these things. And if they don't know how to use them appropriately, they're even at bigger risk. And if we haven't educated them appropriately, that is our fault, okay? Because they could really injure themselves and get hurt because they don't know what they're doing. So we want to assess their knowledge level and their capabilities before coming up with a plan for them, basically. I don't want to say, hey, my plan is for Mr. Smith to use his walker to walk up and down the hallway 4 times independently, if I don't even know if he knows how to stand up with it, right? I don't even know if he knows the right hand to carry the cane in, or does he even know how to swing with his crutches, right? Or how does he get in and out of a chair with crutches, walker, or a cane? It's not like you don't want to teach them how to do that and then later figure out, oh, they have a sprained wrist, oh, they broke their finger in their fall. They can't really grip the way that they should. Maybe I need to get a different walker and one that rolls. So that's really, really important. And leverage that healthcare team. I've had times where physical therapy has come by and say, hey, I'm going to get this patient a walker, and I'm actually in the room with physical therapy while they're giving them the demo of the walker, seeing what they know, and educating them on it and making them do a return demonstration. So we're both in there doing that together, so we're very sure that this patient knows what they're doing with it. So like the nursing process says, the first thing you've got to do is assess their ability first, then plan the care as appropriate. So that concludes episode 60, Assess Patients' Ability to Balance, Transfer, and Use Assistive Devices Prior to Planning Care.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.